why go paperless, and how can billing and eMR solutions drive growth is the topic of today. And given the topic, I think the first thing we need to unpack is what is growth and what are the levers of growth in a practice. And so I'm going to draw a picture for you which we'll refer to along the conversation today. But of course, from a business perspective, the first element of growth we think about is growing the profitability of the practice, again from a business perspective. But there's this other component that is sometimes forgotten, which is growing the asset value of that practice. In the end, one would think that the healthcare professional wants to retire, maybe early retirement, go to the fancy island of Waikiki because of all the good work that's been done. And there, the real value is the asset that's been built over those years of servicing those patients. So I want to talk about those two and how those two work together ultimately. Now, if we start with growing profitability, clearly there are two drivers. The first one being increase in revenue, which in itself is a mathematical calculation. It's really on average, how many patients do you see times what is the average price points that you charge per encounter with a patient. And the other driver of the profitability are your costs and how one reduces costs. And there I'd like to talk about two buckets, your operating costs of your practice, and secondly, an often forgotten cost, which is bad debt. And those four levers really is what drives increasing revenue, reducing costs, which in turn drives the growing of profitability. Of course, there is an interaction between, in any business, not just a medical practice, the more profitable it is, the more value the practice has got. And so there's a very tight link there. But there are other areas that are important as well in terms of the asset value of the practice. The tangible assets of the practice could be a property, could be a dental chair, and whatnot. A person evaluating a business would think about and consider what are the new revenue streams coming on for that business, so a pipeline of new revenue streams. We'll talk about that. And lastly, there might be an opportunity to do an acquisition or a merger to consolidate. Right, so let's go down those paths and discuss what the levers are and how billing systems and eMRs, by going paperless, can leverage that. So, patient volume. Patient volume is really a function of, in a practice, how many rooms there are, with a practitioner per room, the number of days that the practice is open, and of course the average patients per day. And that ultimately makes up your monthly volume in one form or another. Now, from a growth enabler perspective, the key things to consider is that actually your practice is like an airline. It's like an airplane. If there are seats that are empty, you're not going to sell those tickets. There are revenue opportunities gone forever. And of course, the other big driver is how does one go about increasing the capacity of that business, of that practice in your particular case. So things to consider from a billing system perspective. How do we ensure that the seats are full, that the airline is full? You know, airlines only make a profit once they're over, I think, 85% of all tickets sold. I suspect a practice is similar. So is it easy? Does your billing system make it easy for telephonic calls and appointments to be made? Is there a way for patients to make online payments? Does it handle walk-ins quite well? Does your waiting room manage emergencies well in case of somebody walking in? And does it cater for different modes, be it in-person, telephonic, or video? Those are all dimensions that your eMR system should help manage to ensure that you maximize the capacity of the practice in its current state. No-shows, as they call it in America, can be a big thing. An appointment is made, in good faith you wait, and then the patient doesn't show up. So things like reminders from your billing system a day before, just to keep present of mind, should automatically be triggered by your billing system to avoid those no-shows as best as possible, to fill the capacity. And then another one that's maybe misunderstood or a bit of a surprise for me, when doctors started buying electronic medical records from us, we thought, great, they want to treat clinically, which they do, but the smart doctors also say, I've got that filing room in the back. And frankly, that could be a nursing station or even a fellow doctor could join me in this practice to increase capacity. So ironically, an eMR, as much as it gets rid of those paper files, creates more real estate to increase potentially the capacity of your practice. And lastly, from an EMR perspective, you want to be able to be attentive and mindful with your patient, and at the same time very effective in your diagnosis and your clinical note-taking. So does your EMR ultimately beat the mighty pen that you have got very good at using and scribing, in fact looking at your patient's eyes and conversing with them while writing at the same time? An EMR, a proper EMR, will in fact help you to be more effective and efficient, but still not lose a connection with that patient. Let's talk about price points. I went into our data beginning of the year, and I looked at the 0191 tariff code, the consult for GPs, across all medical schemes, plans, and options. I found 976 different price points. As a practice, there are 976 different price points that different schemes will or won't pay. And some of them, if you charge just 1 cent over, will pay you zero, pay the patient the tariff amount, and then you have to chase the money from the patient. So that is a crazy consideration. So ensuring that your pricing levels are correct, sometimes, depending on your specialty, that even the coding is in the correct order. We found with anaesthetists, for example, just by correctly and ethically presenting the order of the modifiers, the final bill can be modified by about 13%, again, completely within schemes rules and within ethics. And of course, many doctors in good faith, forget to bill the consumables, the gloves, the strips, urine strips, and so on. That can easily be about 12,000 Rand a month if your system doesn't catch those things. So, how does one go about that? First of all, your system needs to manage that pricing complexity. By scheme, by plan, per option, in some cases, depending on your speciality, maybe even custom pricing, if you choose to go above rates. Your EMR needs to automatically bill what you do. There shouldn't be a need to capture a claim in your practice. If your EMR is good, you document what happened with the practice, with the patient, what you diagnosed, what you undertook at that point in time, and automatically the claim should be generated. And in fact, by the time the patient arrives at the counter to check out, the result of the claim should be there, and any outstanding amount should be able to be settled. So that was gross profit, revenue, volume, and price points, and how your EMR and billing system can assist you in that regard. Let's look at costs. And the first one are the reduction of operating costs. This is a very busy chart, but it shows basically all the important steps between the practitioner, your front desk, and your back office desk that need to be taken in order for you to be paid for the services that you render. It is a bit of a nightmare, and lots of opportunities for things to go wrong, for things to be delayed, things to get stuck. So when considering your billing system, first of all, what you actually need is an executive report of how the operations of your practice is running. Do you have a finger on the pulse of where the revenue streamlines are, how your practice staff is performing in terms of submission cycles, how often are they sending claims, what percentage is being rejected, why are they being rejected? That gives you a very quick sense as a business owner of where your practice is going without having to spend hours of delving into the details. So that, I would say, is your first consideration. The second one is the risk of bad debt. Now, this is taken from the TransUnion report, which shows the changes in defaults of consumers. And of course, you as a practice reading a professional service, if you haven't collected in real time, then you are going to be chasing money, and you are up to this risk as a general service provider. And so the key things that you want to ensure is that ideally you can collect immediately, or if not, that you make it easy for patients to pay you. This is some reports pulled out of our data looking over the years, and what we do see is that the proportion of claims not paid by medical aids every year gets higher, particularly as you go towards the end of the year. Now that's driven, one, by patients having to buy down because of tough economic times, and benefits reducing at the same time. And so the out-of-pocket payment that patients are exposed to gets greater, which means the patient liables you need to collect get greater over time as the year progresses. So what can be done to address that? Firstly, your billing system should have automatic benefit checks. 15 minutes before the appointment is due, there should be a trigger to the medical scheme to say, I'm about to see this person. Does this person still have benefits? That empowers your staff at the front desk to say, welcome, Louis. Your doctor is about to see you, but just a note, we need to have a chat on your way out because we see that you've run out of benefits. It at least sets up that conversation up front and empowers you not to run into the bad debt risk side. Then real-time claims have been around since the year 2000. Healthbridge brought it out in September 2000. It is still surprising how little practices make use of it. Your practice should run no different to a pharmacy. Nobody walks out of a pharmacy without having the claim completely processed and the levies and the outstanding amounts paid. That happens, the functionality and the technology is there for a practice of any speciality these days. And if you can't for whatever reason, then make it easy to pay. You are now servicing millennials. They've got apps like SnapPay, so on and so forth. Does your eMR include that in the invoice so that the payment can be done? There was some interesting research done that patients, a very small percentage of patients are malicious and don't want to pay your bill. It just goes, yes, I'll do it one day, just now, tomorrow. And it sits there in that file 13. The easier you make it to pay, the quicker they will do it as soon as they're presented with the bill. So that covered the big drivers of growing profitability. I'd like to spend a bit of time now on how do you grow the asset value, the fruits of your hard work after a number of years. How do you pass this business on to somebody that will truly value that client base, the systems, the processes that you got in place, and not hand over the keys to a younger doctor and say, please just look after my patients and hope you've saved enough over the years to have a good retirement. So the first one is tangible assets. Sometimes it makes sense to buy equipment, maybe even a property, so on and so forth. Sometimes there are really good offerings or sales that come up, maybe frames if you're an optometrist before the end of the year or something like that. And then you need quick access to cash. Maybe quite a bit of money. And maybe your overdraft doesn't cover for that. And certainly, as you know, dealing with banks and submitting financials and balance sheets and so on can be very, very tricky. So how does one quickly attract additional working capital that allows for these opportunistic purposes from a tangible assets perspective? Well, your billing system, based on your flow of revenue, should have partnerships with short-term funders that in 24 hours you are able to get the 200, 300,000 Rand that you need to take the opportunity, a revenue-generating opportunity that has presented itself in terms of a good deal. And that really, you are a very good business. You have a steady flow of revenue, and there are funders out there that would be very prepared to make loans to you very quickly so that you can make use of that cash to take up opportunities in the market for the purposes of growing your revenue and your practice. So that's the first thing to consider. I'd like to talk quite a little bit about new revenue streams, particularly where this market is right now and how things are changing. Firstly, we heard just now, telehealth is a thing. It's not going to go away. We as South Africa are behind. It is a big trend everywhere. And of course, face-to-face is always, in person is always first prize. But what about dead times? It's amazing how healthy people are on a Friday afternoon in some practices. Could that present its opportunity to do some telehealth online consulting? What about flexi hours, depending on where you are in your life stage? What about bringing in locums after hours? There's a bigger need and bigger trend for patients to access doctors after hours. But at the same time, you have your own life. could you not append to your practice and after hours with a locum through a telehealth solution, for example? And very importantly, there are new models of care coming, which I'll talk to you in a second. So from a billing system software requirement perspective, check that your billing system does provide for a telehealth solution, that it's well integrated into your calendar, and of course that the correct billing codes for telehealth appointments, which are different, get taken into consideration. And from your eMR perspective, what you don't want to do is flipping between screens and losing that virtual eye contact between your patient and while you're taking your clinical notes. So the visual contact should be picture in picture as you take the clinical notes. And of course, security is very important. We all heard about how the one, I think it was a cabinet meeting over Zoom during COVID got hacked into. Certainly with a patient perspective, you don't want to have that kind of experience. So make sure the solution is secure, in fact is HIPAA security related, which is the US healthcare standard. Here's an interesting stat. CB Insights, they research where is everybody spending money and investing in major trends, and healthcare is one of the major sectors that they follow. And the interesting thing is that care delivery and navigation technology is by far the biggest place where big businesses and private equity firms are putting money in for the healthcare industry. And what that tells us is that there is a lot coming down the line in terms of how the delivery of care is going to change, specifically driven by digital paths, as they call it. So we're also seeing new insurance models coming through, and of course this AI word is coming out in every way, including in HealthTech. So important, if you're thinking about your asset you want to sell down the line, that this practice is future ready for these trends. And what does that mean tangibly? First of all, already there are incarnations where AI can be leveraged to help you as a practitioner utilize AI as a co-pilot to make decisions like, for example, what are the right medicines to choose given this person's diagnosis, the schemes this person belongs to, the age of the patient, so on and so forth. And again, this will bring value to your practice if somebody sees you adopting these future technologies. And then from an acquisition and a merger perspective, I think we're going to see a lot of activity in the GP practice. And why is that? Because value-based care is being spoken more and more every day as we and our teams go to see the medical aid funders, hospital groups, and so on. And really what that talks about at the end of the day is an integrated practice unit, a care delivery team from different specialities that put the patient at the center and think about the overall outcomes for that patient as perceived by the patient. And so in the end, things like tracking your patient's health over a span of time, it becomes very important. The idea of population management, how you are managing the population of your diabetics, and as a result, the contract you attract becomes important. And so those are things to consider in terms of the billing systems of the EMRs you got, which again positions your practice as an attractive proposition for somebody down the line who might be wanting to either acquire it, merge with it, so on and so forth, or yourself wanting to acquire down the line. And the last big driver of value is your staff and how engaged your staff is at the end of the day. So a positive working environment where the roles and responsibilities of each member is clearly understood. There's the closing of loops and not things left in the air. There's predictability, and your staff aren't angst because they know the cadence at which your practice operates. And lastly, that they have access to consistent and reliable service becomes very important. And so from a billing software perspective, being able to have unique logins per user, allocate them specific tasks, could be I collect the money from GEMS patients, and the other person could be I make calendar offerings, but when Joe's not there, then I also do the GEMS claims. Setting up those rules and those roles and responsibility becomes very critical in terms of bringing peace to your practice at the end of the day. And for you to be able to monitor how each of those staff members are being performed back to those dashboards that we saw earlier. There are a lot of tasks that happen up and down. The patient phones, wants to know the results of the path results. The husband phones the doctor and asks her to pick up the bread and the milk on the way home. Those things happen, and they normally go in little yellow sticky notes up and down. And that's what's creating consternation. So what about a very good to-do manager between the front staff and the doctor, so the doctor doesn't have to be disturbed while in consult, but on those pause moments can allocate and look at those tasks and follow up in the dead times to phone the patient, to make a note to pick up the milk, so on and so forth. Another good example of how you create harmony between yourself, the practitioner, and your staff. And lastly, great consistent service. Is there a little chatbot that will answer 90% of your staff's questions quickly and intelligently? Is there a quick way, if that doesn't work, to connect to a contact center? Are you visited by competent people that really consult and help your practice from a business perspective and from a perspective of delivering great healthcare to your patients? And so in summary, if one thinks about how to drive growth, both profitability growth and asset value growth, the levers are revenue, cost, assets, new revenue streams, and the possibility of merging and acquiring with other practitioners as the landscape changes. And certainly the selection of your eMR and your billing system, therefore, becomes a very strategic decision. And I'd highly recommend, on the basis of this, not to be on paper, obviously, which I don't think too many practices are, at least in the billing system.